Okay, colleagues, let's get stuck in. So welcome to this DFMPC Professional Learning Series hosted in collaboration with the CHSC. Delighted that we can get stuck into another meaty discussion and topic. This, I think, is the third in our series around the OSCE theme, although we're segueing a little bit more broadly than that under that particular theme. And this is the Tech Tuesday, having had the learning workshop and the journal club prior to this particular theme. We move on to a new theme next week, which we'll give more details of at the end of today's session. But really pleased that we have Lizelle, your good expertise available to us today. And thank you so much for your agreement and willingness to engage with us today on this particularly important topic of tips for teaching clinical skills remotely. A very interesting topic. And let me just pass straight over to you, Lizelle. Thank you so much.
Thank you, Prof, and everybody. Welcome to today's session, and I would really hope that you will engage and give your opinions. There's no right or wrong answer when it comes to teaching, because we all experience today's world differently. I want to upfront apologize if my dogs are barking in the background. They are very protective of me, and if anybody shows their face, then they start barking. So if you hear them in the background, I do apologize upfront for them. So I'm going to share my screen. And it's always very difficult to understand which one you want to have. Now you must tell me, are you seeing my PowerPoint?
Yes, we are. Lizelle, loud and clear, if that's the phrase. I don't think it is, but very clearly. There we go. Now you've put it onto screen view. So, presentation view. We can see that nicely.
Okay, great. So today we're going to talk about teaching clinical skills remotely, and you will tell me, but we've been teaching clinical skills for forever and a day. So why all of a sudden is it now so important for us to know about this? And you know that when we are teaching clinical skills, as Dreyfus and Dreyfus are saying, that we are wanting the students to become experts. We want them to become confident and competent in performing their clinical skills. And in today's world, we are not always that sure that people or that our students are that confident and competent. I know from a nursing perspective, we teach, we demonstrate, and then we say a little prayer upstairs to say, please hold your hand over the students and the patients for that matter, because we cannot control what is happening in our students. But to get to the student to that stage of where they are, the skill became a habit. They don't have to think about it anymore. It's the process of how they explained it, learning to drive. And you can see that there's 4 quadrants. So in the beginning, the student is unconscious, incompetent. They are excited and they just want to get on with it. They want to learn a new skill. They want to get into patient care. They want to go into taking up the scalpel, not knowing what they don't know and what the implications of their incompetence might be. So what they say is ignorance is bliss. And then they move into the conscious incompetence, where they got the manual, they got some exposure, and they get behind the wheel of the car. And then they realize that it's not as easy as it looks like, and they are not sure that they are able to manage or do anything if something would have gone wrong, or what all the equipment is used for that is light in front of them. So they might start to feel demotivated and become withdrawn. And if we as educators or lecturers are not aware of this stage and don't pick up on this, we might lose students that are either withdrawn and they are never going to have the courage to perform the skill, or those that are not being told that, you know what, you cannot do everything from the beginning. You have to practice first, so to reel them in a little bit. And then you go into the stage of conscious competence, where they are ready. They've done it a few times. They know what all the equipment is there for. And now that they know, now they can actually go and do a blood pressure. They will be able to give the reading. They might be able to suture a wound. So they know that they can do the skill. They can go into that OSCE and they will be able to pass. They know just enough to be able to tick the boxes. But then it comes in that we need to give them an opportunity to practice, and where they become it becomes a habit. I mean, when you are driving to work, how many times have you got to work and you can't say how many times did you turn on the indicator? It's become a natural, it's a habit, it's unconscious competence. And this is where we want to get our students to. So then I want to get to this discussion point. How did we teach clinical skills? And basically what I want to know is, how consciously did we prepare our students to become that competent and confident, and not just prepare them to be able to perform in an OSCE? And now I don't have my oh, there we go, I can actually see you guys now. I've got two screens. So I want you to think about and please engage. How did we teach skills, and did we actually achieve to get the students to that expert by the time they get to the OSCE? How did you teach the students? I'm going to put any Janus or Prof. Richard, I'm going to put you on the spot to
Yes.
start off. So
Bedside, I think, Lizelle, is well, that's one of the important environments, important contexts in which we teach clinical skills, certainly before 2020, that we've been grappling with doing as much of as we perhaps would like since.
Okay, so bedside teaching, and what was the processes that you followed at the bedside?
Frequently, a student clerking a patient and giving a case presentation, to which the preceptor stroke trainer would then respond, perhaps engaging with the patient to verify history or to verify certain examination techniques during or after the presentation. So in a small group of 5 or 6 around the bedside would be a typical scenario.
Okay, so it's basically on the spot training, so or the student will have time to prepare, but it's not real. Well, there might be some skill, but it's one student that might have gotten the opportunity to do an assessment, or where the others were standing around and observe. Am I correct?
Correct. We were trying at the time to move away slightly from as many perhaps formal, slightly superficial, if I may say, in some ways, group, case presentation within a group, but rather trying to make it part and parcel of service learning on an individual basis through the workplace-based assessment methods, whereby we might just be able to give feedback on an individual basis as and when the opportunity came. So that it's more integrated within the into service learning.
Into service learning, I hear. So and that's basically what most of us are doing, because of the student numbers that are so big, and it's becoming increasingly more difficult to to manage the groups and give that opportunity for students to practice and really engage. Nabila, I see that you've also said that in a clinical skills lab. I think yes and no. Sometimes it works with reinforcement, enough time for students to practice and to reinforce it in clinical space. But if it's just taught once and demonstrated, then there are poorer outcomes with little understanding of the skill. And I think we've all experienced it in the skills lab, in the simulation lab. The students are getting a chance to practice, but you've got limited equipment, and the engagement is not there that we really would like it to be. And they mostly taught face-to-face in the skills lab, in the simulation lab, used mannequins, role-playing, and we allowed students to practice in front of us, with us. So we've basically followed some of the principles that Peyton's four-stage approach, and you've all mentioned this slightly, to say that there was some demonstration where the skill was demonstrated by the teacher without commentary, or you might have went through it step by step, saying to them, listen, this is what we're doing, this is why we are doing it. So that's the demonstration. You guys mentioned that. There might be some discussion around, or you've given them some task to say, listen, here's a checklist. So if you are performing a skill, these are the steps that you need to follow. And then using the checklist for them to understand why it is important, what is the implications. It might be, might not be, to a certain extent. But my question around the discussion here is, what is the evidence that we used? So if you prepared your demonstration or your session in the clinical skills lab, and you prepared your demonstration, where did you get your evidence from to say that this is how we perform this skill? Let's take putting up an IV. This is the steps that we follow. Is it based on our own experience, or was it based on evidence and the latest evidence? I know that I'm putting you on the spot. So Nabila, I know that you've mentioned that the clinical skills lab, so I'm going to put you on the spot to say, how did you prepare for your session in the skills lab?
Hi, Lizelle. Good afternoon, everyone. So I think it's a little bit different. If I was teaching a first year or a second year skill, my preparation is a lot different to a third year, which is your final year clinical associate skill. So for example, with the first and second year, what would be done is sending the students, the skill sheet, the outline in advance, at least, a few days before, with a bit of guidance or instruction as to how the session will be taught. And then in the lab itself, or in the clinical skills room, I would first talk about the skill and then ask students, of course, questions about the skill. Then I would demonstrate it and include components where, why am I doing the skill in this way? What am I expecting to find, and why is that important? And then the last minutes would be each student getting an opportunity to practice the skill, and then, with me giving feedback. With the third year skill, it's a lot more easier for me because they're your advanced students. So a lot of it is less hands-on teaching, but more helping them to integrate skills. So for example, with a third year skill, it's like an ACLS scenario in the simulation lab. And with SimMan, it's a thing of giving the students a scenario and then getting them to just go ahead, identify the problem, solve, and there'd be debrief and feedback after that. So the preparation from my side for that is, coming up with objectives, a clear lesson plan, clear objectives for the students. And then what I do before that is send the students an outline of the type of skill we're going to do. So is it an emergency medicine skill or an obstetric skill? Telling them it's going to be on SimMan, so they know it's high fidelity, and then telling them what resources will guide them for the skill without telling them what the skill actually is. And this is mainly because they're your final year students, so I expect a bit more. that was a lot, but I hope that answered you.
No, that is so. You can actually see in the you've managed to address Peyton's 4 stages of teaching clinical skills, and I've given you some resources of publications where they explained the Peyton's 4 steps, and we've been doing applying these skills without us knowing that it's actually grounded in some theory. I can speak for myself. I can't say that's for everybody, but yeah, when you start teaching, you do things instinctively, not realizing that you are actually doing the right thing for the right time. So you've talked about the demonstration, you talked about discussion. They need to understand why it's important, what is the implications. Comprehension is where we can also ask the students to, and you've mentioned it, they are then practicing it, performing it, and you can give them feedback. What Peyton is suggesting, that we are giving the students a chance to, you are performing the skill and they're giving you the steps so that you can follow it. And then execution is also where the student then perform and that peer-to-peer assessment. Is there any comments, questions, concerns, anybody that has got a different view or a different take on how we teach clinical skills, what is important, or even if there's some frustration around teaching clinical skills? Because it's one thing to demonstrate, and it's not to say that the student is grasping all the finer nuances with the once-off demonstration. Yes, open up. I've got 10 minutes to have a discussion before we go through to the clinical skills platform to play around on that. Any comments? Are you happy to move on? So now we've got Peyton's 4-stage approach, but this is very good with for face-to-face or in the normal environment. But what are the challenges we would face on the online environment? And this is where I'm coming back to you, and you can maybe put it in the comments if you don't want to raise your hand or talk. But what are the challenges that you face from 2020 with the lockdown restrictions, specifically in teaching skill? Because now we can't have a group of students in the skills lab because we're too close together. We can't have them in the hospitals because some of the wards were closed for COVID patients only. So how did you manage, and what is the frustrations, and what are your concerns when it comes to now you have to teach these skills remotely? Viwe, I'm going to put you on the spot because you were also brave enough to comment in the chat box. Not to be putting anybody on the spot.
No problem. Hi, Lizelle. Hi to everyone. I think one of the biggest challenges for me is that, okay, we can't see them. I don't know if they're practicing. Just looking at the OSCE marks, I feel like they're probably not practicing as much. And I think there's a lot of disruption, or there are other influences that have maybe negatively affected the students during this pandemic time since last year. I think they're not really practicing the material. They're not really engaging with the material. And I don't know if it's because we're not as close anymore, or we're not as in touch with them, that the motivation or the drive has somewhat decreased. But that's my feeling.
Okay, so the motivation, and we are not in the driving seat anymore. When you teach clinical skills face to face, you've got an eye on the student, and you can immediately pick up which ones are going too fast and who is going too slow, who is struggling, who is losing their confidence. And in the online environment, like you say, you can't gauge the performance or the skill. Yandisa?
Good afternoon. Can you hear me?
Yes.
This is a question because I'm so new in this teaching space. How do you teach a clinical skill online? And where are the students supposed to practice? Because I'm hearing they're not practicing enough, but what are they supposed to practice on?
Yes, it is. It is a difficult. You have to rethink your objectives and how you want to achieve it. Because yeah, but if you think about the steps that you follow with the face-to-face class, you are demonstrating it, and there's a way of demonstrating a skill online, and there is different ways of engaging. That might be useful to use in a blend of ways moving forward. And yes, the facial expressions are lost, especially as I don't even share my video because I've got a bad hair day as the day went on. So yeah, people are hiding behind the fact of we are not putting on our videos. So what are we going to do with our students? So adapting our the Patent's 4-stage approach, demonstration can be done via video recording of the skill. And this is where the Elsevier clinical skills platform is quite useful. And not that I'm promoting Elsevier. People might say, Lizelle, are you getting paid by Elsevier? I just like their resources because there's different ways of using it in teaching specifically. So recording of a skill, either you do your recording yourself or you can find a YouTube video, and I'm sure you all have done that in the past. Having a discussion, you can still have it. Getting a checklist to the student, either to ask them to create a checklist themselves for the skill that they want to, what you want them to achieve. So let them unpack what is the steps that needs to be done and create a checklist for that. And then let other groups of students critique performing the skill according to that checklist and see if it's working or not and critiquing it. So there's another way of using it in an online, but you can also do it in a face-to-face blended learning. Comprehension. Now, this is where you have to become very creative in the sense of combining educational resources. And you can either ask the students to, in a 5-minute session, narrate the steps from memory. So what are you going to do? What's the first step, second, third? So give them a shorter span of time so it becomes automatic, that they don't, they can, repeat it very quickly. Or you can ask them to do an audio recording, a voice recording, a podcast around the skill to understand what is happening. But what we like to do, and it worked quite well, but then we started overusing it and the students got frustrated with, if they see another flip grid, they want to flip the grid. So that's a platform where the students could upload a video of themselves, and the students can comment on one another's video, and they can, and then you can say, so look at 5 students performing the skill, use your checklist and rate them and give them a score. Because then you can also see if the students are understanding and are able to assess another student. And then execution, that's again where the students are performing evaluating, peer assessing, evaluating one another. What we've also done for our students is that we've given them a list of the key core skills that is key, that they need to have an understanding, that we really want to see that they are able to do that. They had to record themselves, and then they upload it and peer evaluation, and we did moderation of how well did they perform the skill, and that, instead of having them in an OSCE. And you can also have an online quiz about the skill, asking them certain questions or give them distractors so that we can see if they are having an understanding or not. So coming back to you, asking you, will this work for you? Do you think this is a workable way of changing how we are teaching skills? Yes, Mervyn.
Thanks so much, Lizelle. So far, I'm overwhelmed. Yandisa and I come from the same discipline. We're both gynecologists, and we appreciate what is trying to be done. but there are certain sensitivities and certain practicalities that you can't teach online when it comes to gynecology. And I'm thinking of the most common discipline, and that's how to pass a vaginal speculum. So I understand that everybody's going to criticize, or people are going to watch YouTube videos. But watching a YouTube video about how to pass a speculum certainly doesn't give them any skill at all as to being either sensitive or practical. And I'm terribly concerned, not that I'm not involved, but I'm terribly concerned about the fact that we can teach them the skills and they can go through the verbal and intellectual motions, but the actual practical application still, for me, is missing. Thank you.
I hear what you are saying, and Mervyn, you are absolutely quite right. There are certain things that I've got a concern on, something as basic as teaching how to do a blood pressure. Now, you can sit with the student, but you don't know what they hear or don't hear. And you can give them the sounds, but at the end of the day, the stethoscope is in their ears, not in yours. So you don't know if they are actually hearing what they're supposed to be hearing. So yeah, I think there are certain concerns, and some students get away with of pretending that they understand, and in actual fact 3 years down the line they actually only the penny drop. So yes, certain things you cannot do online, but it can be once they are in the workplace, or once they're in the clinical space, at least you know that they've got the understanding and they know the ins and outs, and they might have seen it, and then you can guide them. So it's fewer skills that you have to concentrate on doing in the clinical practice, instead of having all the skills to be taught. So yes, there's definitely an aspect of you cannot do everything, especially with the motor skills, that motor function skills that they need to be able to perform. So dentistry, I think, is also one of those very difficult courses to be taught online, because you need to be able to use your hands and use work in fine or small places. So what I'm going to do now is just to the next step is actually show you a platform, the Elsevier clinical skills. Now the nursing department has got this access. And if you want to get access to this, your own personal one, I will gladly set you up, and so that you can play around and see what is there and what's not there. And and I will play around with it now. If you want in your own computer, you're more than welcome to access this. The login details is demo, and the password is hello. And you just click on login, and you will be able to get there or enter the site. I just want to unshare so that I can share the other screen. Sorry about that. And I want to share this. Now you will see how many things I've got open on my desk. Let's just do this. Okay. So this is the clinical skills platform. So unfortunately, I can't see whose hands are up and if anybody wants to talk. So please just talk over me if you want to ask a question or say anything. Or the first thing that I'm going to ask you is, what skill do you want to be demonstrated on? Anybody?
Can we do that one of passing a speculum?
Passing the speculum. So what would be, so, okay, let's go to, at the top, you will see you've got home, and this is my home page at the moment. There's the skills. So we will go into the skills, and we will say we want to view all skills, and you will see that I know that it's based on nursing, but I'm sure that there will be quite a few things that is relevant to everybody. Let's just type in specu. limb. Okay, so this is the how the skills comes up. So you get a quick sheet that the students can work through, and it's giving you an alert. And yes, the first thing that you're going to tell me is yes, but it's American or UK based, and we don't have all the equipment or the resources. Just keep it in the back of your mind that this is what's available, and I will show you at the end a way of how we can make it ours. So this is the information that they've given. It's a quick sheet, and it's quickly the steps of perform hand hygiene before the patient contact, introduce yourself, and it goes down through right at the bottom. And it gives you that it was published in March 2021, and a clinical review was done by Gloria Miles, who is a midwife and a professional nurse. So there is how the speculum will be placed. So there's some images or illustrations on the quick sheet. You can actually print it, and the students can also have access to this, and they can print the sheet themselves. On the extended text, now it's giving you an overview of what it was, and you will see that there's references over here. So they will tell you in which textbooks they found it, which is the guidelines, the standards that they were using. If there's any education that you need to give to the student, how would you prepare for the assessment, the procedure itself. You can see that there's a whole list: monitoring and care, expected outcomes, unexpected outcomes that you can find. And then they've got references. So these are the references that are linked to this particular skill. And then also they've given you the level of evidence. So on what level is this been based on? So that's why I like it. And again, you get all your illustrations. Supplies, they've given you a list of supplies that you would need for this skill. So the student can go through this in their own time. They can really have a little quiz for themselves or you can ask them to create a quiz for somebody else to see if they've got an understanding of the theoretical implications and background. And yes, I admit it's not giving them the actual skill. Unfortunately, this skill doesn't have any videos. Illustrations are the ones that has been provided. And then there's a test. And the students, if it's allocated to their e-learning, if you assign it, then they will be able to do this quiz. And you can see the answers. So it's to monitor their own plan. And then also you get a checklist. That's based on the steps, and it's worked on satisfactory, unsatisfactory, or not performed, and you can put your comments here. And again, if there's any related skills or material, then it's at the last placement that it's been given. Any comments so far?
Thank you very much.
Okay. I just want to... Yes.
Sorry, Lizelle, if I may. I think so. We want what I'm seeing from this as well is that we want to look at it through the benefit of this through slightly different lenses. One is the actual practical, the training of the practical skill of passing a speculum appropriately and professionally and correctly. That there are and there are limitations to using such a platform to do so for not being able to in terms of the video, but more fundamentally in terms of being able to train and assess a student who's actually doing it, but then to couple it with other platforms. So this can be the framework of the approach that needs to be taken, and then Flipgrid and the like can be where a student would upload a video, mindful, of course, of the privacy issues of gynae and obstetrics, which of course makes it further difficult. So, but but they're different, they're combinations of platforms and tools that together can assist us, I think. And the other area that I'm mindful of is that Dr. Mlando or Dr. Jacobson, for example, may be able to use some of these frameworks as part of faculty development, to take a junior trainer, and just this helps to provide a framework by which a written framework for the procedure. Am I correct? I'm just trying to.
Absolutely. So what we've done in nursing with our new curriculum that we had to submitted to the South African Nursing Council, we've given them access to this, and we say, you know what, everything is on here, but we will South Africanize it, and I will show you we've got a custom where we can, because this link is to our university only. So we can create our own skills, upload our own videos that we can use within and create our own checklists. We can edit existing ones that's on the platform available. I mean, there's something like 800 skills available here that we can customize to our needs for and what's available for us. And use it within the faculty. So yes, I just want to show you some of the videos. So you get an animation and then audio of lung sounds. So I don't think I've shared it with sound now, but you can play on you've got access to the platform. So please go and have a look. I just want to show the custom here. Content. You can grade the students if they are doing something here, but we can actually assign assessments to them. We can edit the assessment. So you can create our own platform here. I just want to you can assign training, and students can actually go and look at their own place as well. And this is where you can edit the skill and the platform that is available on here. But we will do training so that we all, everybody that has got access and is using this as a skill will be that we work the same, and that we are peer reviewing within the faculty, so that we are using the same, speaking the same language. I just want to go back to the skill so that you can see. Come on. There are various specialities that you can use, and you can see all skills 785. And some of them are giving you patient education. So this is a clinical education. You can browse by category. So there are various ones. And it ranges from, you can see there's interpartum, there's medications, there are, up to wound care, vital signs. So it's a broad, and we can add our own. So if there's anything that's not listed in here, we can actually link it to that. I'm just going to unshare that. So yeah, questions, concerns.
If I may.
Yes.
This is excellent, but I know Prof. Cook is very enthusiastic about teaching the teacher, and I think for that purpose, these clinical skills profiles would be excellent. But for an undergraduate or a new postgraduate, these skills may not be as efficient in terms of their opportunity to acquire the tactile and emotional skills that are required. Thank you.
And this is where we can actually have the opportunity for the postgraduate students, or even the fourth and your later year students, to actually create the content. But for them to provide the same level of theoretical underpinning of the rationale for each step. Why are we doing it in a certain way? What is the evidence? So basically have the evidence-based practice principles behind it. So this is the standards that we are using. These are the resources that we based our information on. And then that can be used for the junior students then to as a learning tool to be moving forward. So we have to step outside of our comfort zone of wanting to control what we are teaching and making the students the teacher and manage them in the sense of that the information that they are providing is true and correct.
Lizelle, if I might ask, please, whether can we discuss a little bit more the experience of yourself and those on the call of students uploading their videos of themselves and coupled with that doing a particular skill and coupled with that the evaluation, the peer evaluation, one student of another, and being able to give that feedback. So perhaps using this as a foundation for what they're supposed to be doing, and then uploading a video of their particular skill. Let's set speculum insertion aside, because I think that's a tricky one. But what that experience of perhaps from yourself, is that something that you have used a lot?
Okay, I can tell you different ways that we've used the teaching clinical or teaching skills. So for our 4th years, we because one of the roles of a professional nurse is that they have to be teaching on the wards. So we said to them that they have to create a teaching a skill online. And recording themselves so that we can see the skill. And one student went and did hand washing. And I know it's a simple, and everybody will say, yeah, but hand washing is easy. But what she's done is she went and took water paint and washed her hands with water paint to show the areas of where she did not touch and say, okay, so how well did I wash my hands? And ask the students to critique her steps. So that was her way of using the video. So she created the video, she did this skill, and then asked her viewers to critique her in performing the skill to see if they could identify the missteps that she did not perform. So that was one way of doing it. Another one was that we had the first years record their basic skills. So we did tell them that they cannot use patience, but they could ask their family, a friend, or anybody that consented to play the part of a patient. So instead of having a standardized patient that we provide them, they could do it on a family friend, but they had to record themselves doing a history taking. Another skill was doing the TPR of a patient. So that was the basic skills, doing a urine analysis. Then we would have uploaded that to our LMS, and in therapeutic sciences, we're using Moodle. And they've got an activity called workshop, which is actually suitable for peer evaluation. So the students then uploaded their a checklist of how they reviewed the videos. And peer evaluated one another, and then they had to comment on the mistakes and what they have learned on what the mistakes of other people, or what other students were doing that they didn't think of looking at the video. So those are some ways that we used it within the nursing department.
Thank you. I know in the integrated primary care rotation in GEM4, we at one point up to a couple of years ago, we had students upload videos of them doing their mini CX and the like with peer review of their performance. And in fact, we then moved to them doing it student to student, so it was simulated, a student playing the role of the patient. And I guess for each of these methods, we want to be doing it in an efficient way, but for each of them recognizing where the gap is, where the fault is, where the limitation is to each of these tools. But as long as we do that, as long as we clearly articulate the limitations, then we want to use all of these platforms and tools in the best possible way. Is that a reasonable statement, Azal?
I absolutely agree, because nothing is perfect, and we have to be honest enough to say that even face to face, having a demonstration. I've been part of the GEMP students where they were doing phlebotomy, and some of my hairs would raise because I come from the laboratory environment, and knowing what I know and knowing what I don't know. We take shortcuts, and students are going to find the shortcut, and you cannot correct everybody on the spot. So yes, there's limitations to face-to-face, there's limitations on practicing the skill online. But if we're using a combination and playing to the strength of what is available, so using a platform that gives you an opportunity to give the students evidence-based information around a clinical procedure that they can interrogate and say, you know what, but this is not working, or this is how I should adapt it within the South African context, because we don't have A, B, C, and D, or our population presents with this challenges, so therefore I have to adapt, but then base my adaptations on evidence. And then using the clinical platform, you cannot take away the actual experience, but then at least you've got resources to your available to you to refer a student to, if you see that they are struggling, to go and re-look. Because if you've demonstrated it face to face, the student don't have an opportunity to look at it again. So they might go and search for a YouTube video that shows them the wrong thing. At least we can have a bank of resources that we can say that is evidence-based, and the students are not going to be led astray. So yeah, again, using the platforms, the various platforms, and build on their strengths and use that to our advantage.
Does anyone have a further comment or question? There's such good experience and competence on the call in training and trying to balance the online versus face-to-face engagement. Are there any further comments? And Anaya, if I'm pronouncing your name correctly, forgive me.
Yes, kind of. It's Ania.
Ania, thank you, ma'am.
Yeah, so no, not a problem. I'm from the speech language pathology department, and I'm just curious to find out. I know you said that Elsevier, I always butcher that name, link is primarily for health science, but could a department like us use it, since you've got occupational therapy and physiotherapy? I'm just asking.
You've got access to the resource. Go and have a look what skills are there, because there are assessments on swallowing. There are assessments on ear, or so have a look. If there's something for you that works in it, and that's why I said we can add. So if there are skills that you would like to be added on this platform, we can create that together with you, and we upload it, and then everybody can be taught the same way, without us having to replicate you. We can replicate the content and give people access to that.
Okay, and if I remember correctly, you said demo and hello, right?
Yes, that is. But if you want your own personal access, you can just send me an email, lizelle.kraus@wits.ac.za, and with your staff number and your email address, because that's all I need to give you access.
Okay. Thank you very much.
It's a pleasure. So,
Yeah.
Yes, Prof.
Yeah, so forgive me, I'm dominating. I don't mean to. I just wanted to also note that colleagues on the call, and I've seen it on Canvas when I'm in the background, noting the correspondence with students from lecturers and coordinators, and there's good preparation that is done for preparation that is asked of students before they engage in a face-to-face setting, and I'm mindful that because of our extended academic platform, for Masuji or Dr. Mlando or whoever it might be to go out to Sedibeng district, for example, or West Rand, or to engage in this takes time to go out to engage in face-to-face clinical training. And if one's doing that, I wonder if we can't be slightly formulaic in our approach, that in order to get the best preparation possible for a student before she or he engages in that space as a clinical trainer. And I'm wondering if there isn't a sort of formulaic menu, a recipe that we need the students to engage in, such as looking at the video, engaging with the assessment rubric, XYZ, that just happens as a matter of course, so we get the best. So so we get the best value add, or the best value for our clinical educators and lecturers going out into the clinical space and training. Because it strikes me that the online engagement around a topic follows a clinical engagement, as in around a clinical management or management of a condition, or management of follows for then reinforcing what was experienced in the clinical space. But for a clinical skill, it's the preparation, it's the foreground, as opposed to, it's the precursor as opposed to the follow-up. That's what strikes me as the balance that we need to try to get.
I would support that 100% too, because that's what we've done with the nursing training, is that we've given them, we went through a concept-based curriculum. So if we were talking about thermoregulation, we would give them links to all the skills related to thermoregulation. In the clinical environment, if you were dealing with a patient, you could ask them on the spot, okay, so as part of this, we would need to do this assessment. How are you going to do it? Because the student would have gone through the preparation of to understand. And if they are struggling, at least you've got a resource to send them back to after you've engaged with them in the clinical platform. So it makes the contact time more meaningful, that you can focus on that you cannot teach in an online space or in front of a class, but it needs to be a one-on-one or in a small group. So it's utilizing your time better. I would definitely support that, yes.
Brilliant, thanks very much. It's happening, I think, across many of the programs already, of course. Just a question whether we want to formalize it a little bit more, so that we get the best value for the face-to-face engagements by our clinical educators and lecturers and the like. But good. But thank you, Lizelle. We're closing. We're coming to the close, Lizelle. But any final comments, or do you want to close off on your side? Really interesting. Thank you.
No, basically, this is one of the resources that I came across that I thought is helpful in teaching clinical skills, and just it's based on evidence. It's not based on my experience of how I can or how I've been taught how to do it. It's not to say that I've been taught the right way. So yeah, finding these kind of gems or resources that we can adapt and use to make our lives easier is is worth sharing with other people, that we are not working in isolation and sitting on gems ourselves. Thank you. Thank you for the opportunity to share this. I really enjoyed it.
Well, it's a real privilege to have you on the call and giving your inputs, and not least for your representing the nursing discipline as well. It's of such value for all of us within the School of Clinical Medicine to be engaging with those from the School of Therapeutic Sciences and Nursing and Public Health and all of the other schools within our faculty. So thank you very much for a really interesting session, Lizelle. I really appreciate it. Thank you so much.
It's a pleasure.
And with that, colleagues, I think we're moving on to next week. We begin with a new theme of are we on to workplace-based assessment? Yanis, if I'm getting my dates right, am I correct in that?
Yes, that's correct.
And I think we're going to have three really interesting engagements for over the next 3 sessions, and then that will draw us to a close this year. So I just wanted to flag 2 things, please. Firstly, in relation to these professional learning series, colleagues, please, if there are any recommendations for us to continue around themes for next year, we've already flagged the what was the last one in our meeting last week? It was the theory-based assessments, the assess reliability, validity, feasibility, etc. of our theory-based assessments, and perhaps including, for example, proctoring in remote settings. That's going to be one theme for sure coming up. But if there's anything else, please. You know as well as I, if not more, what would be useful for us to engage in as a collective, and mindful of this cross-pollination over schools, please. So what's happening in the School of Therapeutic Sciences that we're not doing as well on this side, for example, in our department or in our school, but also what's happening all over that we might be able to learn from experts within the faculty at large. So please do flag those for us. The second thing to note, please, is that please be mindful of the just to since I have the opportunity, that we are kicking off with our Imagining Innovations webinar series that's going to be happening at Wednesdays, 1 o'clock to 2 o'clock, including a very interesting presentation and engagement with, well, more an engagement with rather than presentation by our Vice Chancellor. And looking at his moonshot thinking and aspirations as for us as a university, but in many other areas, Indigenous healing and the African traditional healing space, and the innovations that we can imagine there in terms of coming into engaging with the more westernized way of doing things, as an example. So please look out for that as well, and come on board and engage in that interesting webinar series, guys. Thanks very much. And with that, let us close, and our deepest appreciation to you, Lizelle, again. Thank you so much. Thanks, everyone.